Hi there, I'm Stephanie Ruhle. It is Wednesday, March 18th, and here's what's happening. As the nation shuts down to guard against the spread of the coronavirus, we are seeing growing cracks in the economic system, with millions of Americans suddenly facing the prospect of no paycheck and possibly no job at all. So I want to start with the number of cases, which rose sharply again overnight, in part because of more widespread testing. Over 6,200 cases have now been reported across all 50 states. The death toll has soared past 100. It is now at 113. Across the country, more and more industries are basically being forced to shut down. In Nevada, the governor ordered all non-essential businesses to close up, including all casinos. In some places, employees are getting paid leave, but many small businesses have no choice but to let people go entirely. Unemployment claims have spiked all over this nation, threatening to crash computer systems in New York and Oregon. In the state of Kentucky, they processed 4 times as many claims in one day than they typically do in an entire week. All of this is adding to the urgency in Washington, where lawmakers are trying to figure out how to get help to Americans who are suddenly struggling. Treasury Secretary Steven Mnuchin pushing a now $1 trillion plan that could include billions of dollars for businesses, but more importantly, direct cash payments for people who need it most. But last night, New York City Mayor Bill de Blasio, who is considering shutting down our entire city right here, said even more than that is needed.
My concern right now is if we don't see a federal intervention, and I literally think the only example is the Depression and the New Deal to guide us. If we don't see an intensive federal intervention to provide income replacement, meaning not just a $1,000 check one time or unemployment insurance, but a serious effort to keep people as whole as possible, you will see household budgets collapse.
A week ago, we were comparing it to the 1987 crash. Now we're talking 1929. So let's take you to the White House, where Kelly O'Donnell is standing by. Kelly, President now says he wants to send checks to people who are struggling. But here's the thing. We have no idea how long this is going to go on. Is he looking to pay people indefinitely?
We don't know about indefinitely, but the urgency that the White House says it recognizes and wants to act on, along with both Republicans and Democrats in Congress, is about trying to get checks within the next month. The Secretary of Treasury said perhaps as quickly as 2 weeks, although that mechanism seems to be hard to identify, where they could get a cash payment to individuals, means tested to some degree. We're still waiting for the details on what thresholds that would be and what amount. That's Congress will have to ultimately finalize the package, and then the president would have to sign it into law. But looking at ways to trigger, perhaps through the IRS, which in many cases has people's direct deposit information and things like that, to infuse American families with some money. Now, does this replace everyone's income? No. It's not intended to do that, but it is the kind of part of what may be ultimately a series of steps. Well, we've identified, Stephen, you hinted at this, within a matter of sometimes hours and days, the scope of the crisis seems to change. And as that is happening, reactions and plans have to change with it. So today we're going to hear from the president. He says he's doing a news conference. We believe that will be in the 11 a.m. to noon time frame. He's also speaking with airlines and physicians and nurses today, trying to get the latest information on that. Officials we talked to here said we expect to learn more about how the Department of Defense will be able to assist with some of the steps that states need and some of the response. Steph?
Quickly, you said means test. So let's just qualify that for our audience. Does that mean the government needs to figure out how much money people have and how much they need? Because we had heard from people like Jason Furman said, write a $1,000 check to every American. But yesterday, Steve Mnuchin said, if you're making $1 million a year, you don't need that check.
It's one of the key questions. I think right now the thinking is that they want to be sure the fastest way is to give some amount to everyone. And then there are some ideas where there would be a head of household who would get an amount for children. One of the questions is, how would you determine what people have as an economic threshold? One way to do that is pass tax returns. That takes time. The fastest way is to do some amount for everyone. And then the question is, if there is greater need for Americans who, one number that's been thrown out, is it a family income of $65,000 or $75,000 or $100,000? Figuring that out is part of what's at play here, and then the mechanism to deliver that. The fastest, simplest way is money to everyone, regardless of need. And, of course, the more potentially long-term helpful way is to try to target it to those who are lower on the income spectrum. And as the Secretary of Treasury has said, we don't want to give millionaires $1,000 checks or people earning $1 million a year. But that's what they're trying to figure out. And they're also talking about tax credits, delays of paying your taxes if you owe taxes, and using tax refunds to try to get people to get some of their money more quickly. So good questions. We still don't have answers on all of that, and that's part of what we'll be working today.
They're not easy ones. Easy to say, let's write a check, hard to actually do it. I want to talk to someone who is in the center of making some of these really tough decisions. Local officials are being forced to deal with this in this pandemic, and mayors are doing it with one another in the absence of federal government cooperation. Lori Lightfoot, she's the mayor of Chicago. She joins us this morning. Mayor, I know how busy you are, so thank you for being here yesterday.
My pleasure.
That was an important day in your state. You had people voting in the primary. Were you on board with that decision? That's hard to balance safety and the need to preserve people's right to vote.
Well, what we did really at least a week out from the start of the election was tell people to vote early, tell people to vote by mail. And we had historic numbers of people doing both. In fact, we're still counting the early voting from yesterday. Yes, it was definitely difficult, but people in Chicago rallied, and we stepped up and we pulled the election off.
How are you making decisions of what to stay open and not? You've got a lot of businesses that have shut down, but you've got your libraries and your city transit still running.
Well, look, we're making decisions based upon the science. I'm consulting literally on an hourly basis with our Commissioner of Public Health and her team. And we're looking at ways in which we're seeing the data move, where we're seeing the clusters of infection spread. And that's how we're making the decisions based upon the science. And I'm also cognizant of the fact, as you previewed, this is a huge shock to the economic system here. What's most important is making sure that people can still get to work, that our healthcare system is still solid, and make sure that those healthcare workers are protected and that they can get to work. And that's why public transportation is still playing a very vital and essential role. But we're paring down to just the bare essentials at this point.
Are you concerned that we're going to get to a point where basic services like the fire department and the police department could be impacted?
Well, I think ultimately that everything is going to be impacted. That's why we're taking the steps now to make sure that we train our first responders, that they know what they need to do to practice self-care, that we're getting them the PPE equipment, the personal protective equipment, that we're educating them about how the virus is spread, that we're making sure that they are checking in with their local medical directors in the event that there's any sickness, and that they're self-quarantining if they feel that they are under flu-like conditions. But yes, we're on the front lines, they're on the front lines, and we need to make sure that we keep them healthy and secure as well.
We got to talk about Chicago's O'Hare Airport before we go.
Yeah.
Yesterday, you had to close one tower because several people tested positive. We know over the weekend you had hundreds, if not thousands of people basically trapped there for federal government mandated enhanced coronavirus screenings. What needs to happen there?
Well, let me just correct a couple things. One is the tower going down for a short time was at Midway Airport. That's the second airport. But fundamentally, what happened at O'Hare over the weekend was completely avoidable. And it would have been avoidable if the White House, if Vice President Pence or anybody in the task force actually talked to local mayors. If they talked to us about how implementation of the travel ban on the UK was actually going to bear itself out. We had people, not enough people at O'Hare as screeners on the federal side, and we had a lot of people leaving Europe, going to Canada, and then coming into the United States through Chicago. all of these things could have been anticipated. We could have game planned for them and had the resources to be able to respond effectively, but we're not hearing from the White House. We got a one-way thing going. They're talking at us, but they're not talking to us and bringing us along in a journey, and that fundamentally is the problem. We need to be in partnership, working together. We can provide necessary information about what's happening on the ground, and I'm going to ask for a specific outreach and mechanism for mayors to be part of the feedback loop in the federal policy making.
Mayor, thank you so much for joining me this morning. I really appreciate it.
Appreciate it. Thank you.
Now I want to turn to Carlos Jimenez, mayor of Florida's Miami-Dade County. Mayor, I got to ask you, is Miami doing their part to flatten the curve? We're looking at pictures of people going to the beach. We're looking at pool parties in Miami hotels. And this weekend, people got off cruise ships without full corona screenings.
Well, the people getting off cruise ships, the protocol is actually governed by the Coast Guard and also the federal government. And so as they get off, they have to be cleared by the CDC, the Coast Guard, and the federal government. That's what the protocol is with the cruise ships. The cruise ship industry now is closed, and so we have no more cruises coming in or out of Miami, and those ships are basically parked, and so that's not an issue anymore. In terms of the beaches, Miami Beach and Miami-Dade took action in order to start closing beaches, especially those beaches that were where all the spring breakers were. So that's been shut down. We've also had closures and curfews in certain parts of Miami Beach where we don't have the same number of people, and so we've closed bars and restaurants, gyms here all throughout Miami-Dade, and we've taken up, we have stepped up our approach in order to start limiting the contact, the personal interaction between people. Now, we had very few cases here in Miami-Dade, and as we've seen a little bit more, we've taken progressive steps. And we may have to take even more additional steps, which we will, to make sure that we limit the spread of the coronavirus here in Miami-Dade. The total number here of a population of about 3 million is about 40 as of yesterday. And so, again, these were measured steps, and we will continue to take these steps to try to limit the spread of this virus here in Miami-Dade.
I know you're taking this seriously. How hard is it for you to convince young people? Every day we hear Dr. Fauci talk about convincing Gen Z of the risks, and you're in an area, you mentioned spring break, with so many of them. Has this been a big challenge?
It's a huge challenge, and so, we, in the midst of this entire coronavirus, and you had thousands of these kids that were there on spring break, and, for them, it's, it's not a big deal. And so that's why we had to take the measures and say, look, if you're not going to practice social distancing, if that's not what you're going to do, then we're going to have to impose these measures, and we will, and we have. I've issued an order yesterday on our parks and our beaches that if we see that there are groups of more than 10 and that they're starting to get too many people, we'll close the beach down. We will close the parks down. Like I said, we've already closed all restaurants and bars and lounges and gyms, and we've also ordered the scooters that everybody uses and the bikes that everybody rents, that those have to be off the streets. I am going to be issuing an order today on casinos to close them down. But this is, we are ramping up to take more and more measures as we see if people do not practice personal responsibility, then government has to take action. And unfortunately, government can't do it all. It's really up to us to assume that everybody has the coronavirus and that we act accordingly, that we have social distancing, that we make sure that when we cough or sneeze, we do it into a tissue, and that we wash our hands when we touch a surface, and when we touch our face, and not to touch our face, we also wash our hands. So those are things that we have to do, that we can do to basically wipe out this virus and this cross-contamination. And so we are taking the steps to try to make it easier for people to do that, because we're going to close these places. But at the end, it's really up to us to defeat this virus.
Mayor, thank you so much. Thanks for your work. I know you're also a former firefighter. I want to thank all the first responders, the hospital workers in your area. We need you right now.
Thank you. Appreciate it.
Listen up. The White House is now considering a $1 trillion package to combat the disastrous effects of the coronavirus on our economy. $250 billion of that would be used for direct payments to Americans. But one part of the plan is already drawing a whole lot of sharp criticism. Industry bailouts, with roughly $50 billion going to help the airline industry alone. Joining us now, Mark Cuban. He is the owner of the Dallas Mavericks, the chairman of AXS TV, and Todd Graves is here. He's the founder and CEO of Raising Cane's Chicken Fingers. He was part of the White House's call with restaurant executives yesterday. Mayor Michael Tubbs is with us of Stockton, California, and Ben White. Great to have him back, Politico's chief economic correspondent. Mr. Cuban, we must go to you first. In the last week, you have done so much for local businesses in Texas, even last night, urging people to reach out for small business loans. But you've also sharply criticized this idea of corporate bailouts. Explain.
Well, I'm not against corporate bailouts. I think we're in a new normal right now. Life is different. And so our number one priority should be supporting companies who retain their employees. We have to do all we can to prevent firings and layoffs. And if that means bailouts, subsidies, special price loans, I'm all for it. But when we negotiate those deals, we have to be very cognizant that this is a unique opportunity for us to do something that addresses income inequality. And what I said was, anything that we do that benefits an executive at a company, we need to do the exact same thing to benefit the hourly worker or the lowest paid worker at that company. 2 years from now, hopefully, when we're looking back on all this, we'll say, why don't we use this as a chance to help the everyday worker? And I just want to get ahead of that. And so, this is the time to address it.
Do we need to look more closely at what kind of industries we give assistance to? Because when you look at the airline industry, one of the reasons they don't have cushion is because they've spent so much in the last few years on corporate buybacks. Or the cruise industry, they're not paying big U.S. corporate taxes like a lot of companies here are. They're domiciled in places like Liberia and Panama.
Yeah, look, the two different questions there. One, the fact that they did buyouts, if you just say we're going to exclude them, you're just killing all the people who work for them. You're just guaranteeing they'll all lose their jobs. So this isn't about them. This is about supporting. This is about helping companies retain their employees so that you can help the employee. Now, what you do as part of that, since the government is reducing, if not eliminating, the risk in their operations for some period, you need to make sure that if an exec is awarded a stock option or a warrant or granted stock, whatever you do for them, proportionally, you do the same thing for everybody else on the payroll. That is the key to making this work. I'm not dogmatic against bailouts at all, or loans or subsidies at this point in time, because we're in a new world that we've never seen before. But we need to prioritize everybody being supported equally. We need to use this as an opportunity to reduce income inequality. That needs to be job number one. Get people to keep their jobs and help lift people up where we can, because by those people retaining their jobs, they're going to help support us when hopefully we can get the economy stabilized and moving forward, hopefully just 6 months from now.
This is a time when we could be moving to more inclusive, conscious capitalism. Todd, you've got nearly 500 locations. You've got drive-throughs at those locations, so people can drive up, pick up food. Some chain restaurants have apps. You had the benefit of being part of the White House call yesterday. The accommodations that are being made, are they going to help small mom-and-pop restaurants that don't have drive-throughs or apps?
Well, unfortunately, the president wasn't able to get to that on our brief call yesterday. The call involved about 23 of some of the largest restaurant companies in the country, and also the International Franchise Association. And he was concerned and making sure that some of these largest restaurant companies were ready to feed the public food-safe products and also practicing social discipline. Now, he did say this next economic package, he didn't get into any details on that, but he did say that our industry is going to like it a lot. I can't remember exactly what his quote was, but he said that we would like it. So anxiously awaiting that. Companies like us that were on that call and that do have drive-through and that do have large credit lines, we're going to make it through this. And my heart goes out to these small businesses. You know, small business, we all know, is the backbone of our economy. The restaurant sector is a huge part of that. I think we're one of the top employers in the country. And so I started my business 25 years ago having a commercial fish in Alaska and reconstructed my first restaurant. I know how hard it is to start a restaurant. And then I know how hard it is to keep a restaurant going. A restaurant, most people don't know this, but a restaurant has to make small margins is what we do off of very large volumes. And a lot of these smaller restaurants, independent restaurants, they live, you know, they go through all their volumes. They might make 5 cents on a dollar, and that's before tax, right? And then you have taxes. They live week to week, month to month, but they do a great job of serving the public food-safe product and also taking care of their employees. Huge sector here. So they are going to need help. I have been on the phone for the last 2 weeks with countless restaurants, both large and small, franchise, independents. And these restaurants that don't have this reserved cash, they don't have this access to credit lines, they're terrified. They're being good and strong leaders, but they're having to furlough employees. And this is happening. I'm on the phone last night, midnight, and more people tell me I have to do this tomorrow. And so all these employees not having income coming in, obviously, they need their needs. These businesses will go out of business. So they do need help right now. They do need a lot of help.
Mayor Tubbs, let's talk about that help, because this idea has now been floated to write a check to the American people. Universal basic income is something you've actually done in Stockton. So you've got experience. Tell us how it works.
Well, absolutely. I think, as you've heard from those on this segment, just throughout, that American people are really suffering during this pandemic. Right now in America, before coronavirus, 1 in 2 Americans cannot afford one $500 emergency, and that's going to be exacerbated as folks are having to not go to work, being laid off, et cetera. So in Stockton, we piloted a basic income demonstration where families have been given $500 a month for the last 18 months. And what we've seen is that folks are using the money to pay for food, pay for utilities, to take care of family members, et cetera. And given the crisis that we're in now, I think it's incumbent on Congress and on the president to make sure we get checks out and we bail out the American people in a way that's fast and immediate and also lasting. It can't be a one-time payment. It has to last at least as long as this pandemic, because again, the majority of Americans were in an economic crisis before this crisis, which means this crisis is further exacerbating kind of cracks in our economy.
Mr. Cuban, your point of view on this cash payment to Americans?
Not a fan. And I'll tell you exactly why. I think, you know, to Todd's point, the restaurants that are about to furlough people, we need to get cash in their pockets first. With the requirement being that they retain those employees and continue to pay them, even if it means government UBI for employees paid through their employer, right? So I'm not a fan of UBI just for everybody, but if that UBI goes through the employer so they can retain people and those small restaurants can stay open, I'm a fan of that. For those people who are on public assistance, you just lost your job and you're now getting public assistance, I have no problem giving them more money, giving them a bonus check, if you will, because you've just started on public assistance, increasing the amount of money for those who are already on public assistance. But those are two independent buckets. And I think the number one priority has to be helping the folks that Todd's referring to, those small restaurants that are living hand to mouth, all companies that are living hand to mouth, because we want to keep people employed. And if the government is writing checks to employers and they're passing that money through as a requirement to their employees and keeping them employed, even if they're just sitting around doing nothing, that's where I would prioritize that money going. So I'm not a fan of general UBI, but effective UBI I'm okay with.
Todd, what is your point of view? Because an argument right now to write these checks to the American people is also to keep them safe. We've got a lot of low-wage workers that aren't losing their jobs, but they don't have paid leave. So maybe they have kids at home, or maybe they're feeling a little bit sick. And if the option is go to work and get a paycheck that can put food on my table, or stay home and take an extra precaution, a lot of people are going to go to work.
Absolutely, right? And so it'll help if these people do have income, right, if they're sick. And if people are sick, people need to stay home. And if they end up having symptoms for the coronavirus, they need to self-quarantine. And that's the only way we're going to stop this pandemic from spreading. I'm in Mark's camp on for going through the employers and making that pass on to the employees. And so that is for loss of income if you're out and you're sick and you have to stay home. That money should flow through the employers and go directly to their employees.
Michael, tell us what it's like in Stockton right now.
Well, I would say I disagree vehemently for a couple of reasons. Number one, there's a lot of folks who are working in the gig economy, DoorDash, Lyft drivers, et cetera, that are impacted by the economic recession that's going to be caused by this pandemic. So I think the federal government has capacity and the mandate to do both, that we have to support our small businesses, absolutely, but our small businesses are nothing without the people who actually make them work and who deliver the food and things of that sort, who may not be directly employed by the employer. And just last night in Stockton, we shut down all our restaurants, we shut down our bars, we shut down all our entertainment venues, and people are really hurting. And I definitely think there's a role to make sure we support small business owners, but we have to ensure that the American people are okay. Because again, before this crisis, 1 in 2 Americans cannot afford a $400 emergency. And I'm not sure how during a crisis when folks aren't working, where business isn't as good, how we expect folks to subsist and survive this economic catastrophe without some sort of an income floor in a way that's investing directly in folks that kind of help make sure our economy keeps going.
Mark, how do you decide when the government should step in? Obviously, jobs matter, but I think of industries like the retail industry, where we know lots of companies in the American shopping mall was kind of getting eaten by Amazon over the last few years. If we see big retailers go out of business here, it could be tens of thousands of jobs, but at the same time, that might be the natural business evolution.
Yeah, I mean, right now you don't try to decide, you support everybody. And I don't disagree with the mayor that we need to help everybody. But I think the point Todd and I are making, not to speak for Todd, is that you do it as a pass-through right now, so that wherever you're working, we want you to try to keep your job, because the challenge is when hopefully things come back, those jobs may not be there any longer. We want to keep those jobs in place. And so the government right now has just got to just open the checkbook, print as much money as it takes. There's no limit to how much money that we will print, and we'll deal with the consequences afterwards, because we need the liquidity in the system. We need people at their jobs. We need people who are, when I say at their jobs, meaning keeping their jobs. I'm not saying if you're sick, you should go to work. Absolutely not. Safety first. But for that person staying home, for that person who needs to take care of their kids because they're not in school, they need to be receiving their salary or their hourly wages as if they worked a full 40 hours, and receive those so that they have an income regardless of what they're actually doing for the job. But they need to be paid in a pass-through manner, because we need to anticipate that the economy will come back at some point, and we want to subsidize and do whatever it takes to keep, those business relationships between employer and employer. Because if everybody just loses their job, everybody goes on public assistance, and then everybody tries to find a job at the same time, that could extend what would be a recession into a depression, and we need to avoid that at all costs. So writing checks to every single industry and having those pass through to their employees, whether they're at home or at work, whatever is the smartest thing to do in this quarantine world, that's what we need to do. Because otherwise, to Todd's point, people are just going to lay everybody off, and they're going to feel okay about laying those people off because they know the government will be there to provide a check for them probably every month going forward. We need to try to retain them at their jobs and keep those relationships alive for as long as possible.
Ben White, what Mark is talking about right there is fundamentally plugging our economy back together. Right now, we're 2 minutes into the trading day, and the market is already down over 1,000 points. And I'm not saying the markets aren't important, but is it a mistake to keep looking at the markets as a measure of how things are going, when right now what has happened has completely destabilized our economy, and we need to focus on stabilization before we look at market performance?
Yeah, absolutely. I mean, I wrote this morning. I think it's a mistake to focus on these wild daily swings. We're going to get them for a while because nobody on Wall Street has any idea the trajectory of this crisis, just how long and how deep it's going to be, and how bad the recession that we're probably already in is going to be. So, we could wind up seeing bank holidays, market closings. It's not the focal point right now. And I would just say, to Mark's point, I don't think that the federal government is going to take an either-or approach here. I think the stimulus that comes out of D.C. is going to include both direct payments to individuals. I think that's pretty much baked in, at least $1,000. And then also supporting employers and small businesses through loan guarantees, through direct payments. This is an all-hands-on-deck approach. As you said, We can print as much money as we need to. We can issue 50 or 100-year-long bonds to fund it. So we're going to do both. We're going to send checks to every American. That's a very fast way to get stimulus into the system and attempt to make sure that a lot of these small and mid-sized businesses don't lay off their employees. And he's absolutely right that any money that's given as bailouts or loan guarantees has to be tied to a requirement that workers are not laid off, that they continue to be paid, that wages continue to go out. So the government has to be careful that there are strings attached to this money and it's not just absolutely handed out. But to the larger point about the market, just get used to these swings. They're going to be with us for a while, and it's not the most important thing.
Todd, Mark, Mayor Tubbs, Ben, thank you all so much. We're going to leave it there. I really appreciate your insights. You definitely got us smarter this morning. We have to now turn back to the race for president. Last night, in a big primary night that was overshadowed by the fight against the coronavirus, and it needed to be. But former VP Joe Biden got one step closer to the Democratic nomination. Former Vice President sweeping the night, winning big in Florida, Illinois, and Arizona, and widening his delegate lead over Senator Bernie Sanders. As he addressed supporters via live stream, he made a direct appeal to Senator Sanders' base, but focused most of the speech on this public health crisis plaguing our nation.
This is a moment for each of us to see and believe the best in every one of us, to look out for our neighbor, to understand the fear and stress that so many are feeling, to care for the elderly couple down the street, to thank the healthcare worker, the doctors, the nurses, the pharmacists, the grocery store cashier, and the people restocking the shelves, to believe in one another. Because I assure you, when we do that, when we see the best in each of us, we lift this nation up, and we'll get through this together.
Joining me now to discuss, Chairman of the Democratic National Committee, Tom Perez. Tom, thank you for joining me. Should those 3 states have held their primaries yesterday, given the public health situation?
Well, what you saw in Arizona, the short answer is yes, I think they should have. And here's what happened in Arizona. Over 80% of the people voted early because they have vote by mail. They have provisions that enable folks to vote before the election. Same thing down in Florida. Overwhelming participation in early vote. Same thing in Illinois. And Stephanie, last week, Washington State held its primary. They are an epicenter of this challenge right now with coronavirus. They held it without a glitch because they're a vote-by-mail state. And so what we have to do is understand that it's a false choice that we either have safety or we hold elections. There are ways to hold elections so that we don't put people in harm's way. And what we have called for at the DNC moving forward, and let me also start out by saying we don't have the authority to postpone elections. That's up to states. But what we're telling states is that you should follow the lead of states like Oregon and Washington State and Arizona and others, and provide no excuse absentee voting, vote by mail, have longer early voting so that you don't have people queuing up. That's how we can get this done. We shouldn't have to make a false choice between holding elections or keeping people safe. There are ways to do this, and moving forward, that's exactly what the states that haven't gone yet should be doing.
You've said to me in the past you are not in the business of telling any candidate he or she should drop out. But last night, VP Biden widened his delegate lead. Now that the stakes are higher in terms of public health, should it be more of a consideration for Senator Sanders to drop out because there's more at risk?
Well, again, that's a question that Senator Sanders will have to address, and he's run a remarkable campaign where we're about 60% of the way through the allocations of delegates, so we're in the second half of this primary season, and he will have to make a judgment moving forward about what's in his best interest, and I don't think it's my place to tell him one way or another. I have great respect for Senator Sanders and for the vice president, and one thing I know, and we saw this Sunday at the debate, is they understand that it's bigger than either of them. This is about restoring America, and they understand the moment, the crisis that we're in, and they understand the importance of leadership. And so I leave those decisions up to the candidates themselves. I've done that throughout the campaign cycle. I get asked with regularity, will you be talking to candidate X? And that's entirely up to them. And I'm confident that everybody understands it's bigger than them. It's about our democracy. And at the moment, it's about leadership during a remarkably challenging pandemic.
Tom, thank you so much for joining me this morning. I appreciate it.
Always a pleasure.
We've got breaking news from the White House. President Trump moments ago tweeting, "We will be, by mutual consent, temporarily closing our northern border with Canada to non-essential traffic. Trade will not be affected. Details to follow." So the president and Justin Trudeau taking more action to prevent the spread of the coronavirus. We're going to give you more details as they unfold. And we've got more information about at least the borders here from New York City Mayor Bill de Blasio. He just finished an interview with our colleagues on the Today Show, now saying he is one step closer to recommending a shelter-in-place order for New York, noting it does not need to be done in coordination with Governor Andrew Cuomo, who has publicly resisted the move so far. Mayor de Blasio also saying he would need the military support for any such order, and confirming there are now 923 cases in New York City, and we will go above 1,000 today. Here's more of that interview.
New York City Mayor Bill de Blasio joins us now from City Hall. Mr. Mayor, good morning. Thank you for your time, sir.
Thank you, Savannah.
You mentioned, I believe yesterday, that New York City residents should be prepared potentially to have to shelter in place, something like we're seeing happening in San Francisco. Then New York's Governor Andrew Cuomo said, no, something like that is not going to happen. Can you clear it up? Where does that stand?
Savannah, I was very clear yesterday that could only be done with the state of New York. What I was trying to say to people is this disease is moving so rapidly. Yesterday, we had over 100 new cases in New York City. We're at almost 1,000 cases right now, Savannah. We've lost 10 people already. It's increasing in a way I don't even think our leaders in Washington begin to understand this. But here in New York, we have the most cases of any state in the country. So what I was saying to people is, get ready for the possibility. It's a decision we would only make with the state of New York, of course. But people have to realize at this point that this disease is going to put many, many people, thousands and tens of thousands of people's lives in danger. And we're going to have to do things very differently. And if we even get to shelter in place, we're going to have to come up with huge new approaches to make sure that people have enough food and medicine, because they sure as hell don't have income right now. One other thing, you heard Secretary Mnuchin, $1,000 in people's pockets is not enough. It's not going to allow people to stay whole and be able to afford the basics in life. Washington has to get real. If we're going to have an unemployment level that looks like the Great Depression, we need a massive federal relief program that looks like the Great Depression, so people are kept whole economically, or they will not have money for food or medicine. That's what I fear.
Well, these are the early days. I mean, there's so much to fear right now. You talked about if you had to do a shelter in place, that question of how people get those critical needs. The other issue, as you well know, is our capacity in hospitals, the supplies, the ventilators, the respirators, the protective equipment. Where does that stand in your mind right now in terms of your own needs and whether there is sufficient resources in the city right now?
Savannah, you know, I spent a few weeks trying to reassure New Yorkers, because we did have a lot of capacity. We do have a lot of capacity, but at this point with the trajectory of the disease, we have to be honest. If there is not a profound federal intervention quickly to ensure that we have more ventilators, we have more surgical masks, all the basic supplies, if the federal government does not get involved quickly, and specifically the United States military, and I spoke to the chairman of the Joint Chiefs of Staff yesterday, the military has extraordinary medical capacity. It's needed in places like New York right now. But it's quite clear that the administration in Washington has not mobilized the American military. There are still there are American military officers right now still building a wall at the southern border when all they should be doing domestically is addressing coronavirus. We need their medical resources, their logistical know-how. We need them to help ensure that food and medicine moves around this country and our supply chain is not disrupted. Right now, we are in the midst of a crisis we have not seen for generations, Savannah, and yet the American military is being sidelined when they should be given the chance to get in this game and help us all.
Can I ask you about the figure that you mentioned at the top of this interview. You said something, I think you said there were 100 new cases in New York City. I know you've been doing a lot of math. Is there anything about that rate, the rate of increase just recently, that gives you pause or suggests that the social distancing that we're all trying to practice isn't bending the curve as much as you want it to?
I think that's the exact problem. So 100+ new cases yesterday, Savannah. That is what I'm seeing as a kind of a gallop now. This morning, the latest news, 923 cases, but we're going to top 1,000 today, undoubtedly. We're going to be at 10,000 not so long from now. When you think about that, Savannah, that kind of rate of increase, what that's going to do to our hospitals, particularly our ICUs, look, this is something that needs urgent intervention by the federal government, and I think we're all going to have to go deeper in changing our approach, which is why I think an honest conversation about shelter in place has to happen. Again, this is a decision that can only be made with the state of New York. I will be speaking about with the governor about it later on today. But I think the time is
real quickly, sir, because I'm almost out of time. Are you going to, I'm almost out of time, but just in a word, are you going to recommend to the governor that New York City do shelter in place?
I'm almost to that point. We have a little bit more we have to make sense of how we're going to get people food and medicine, but I have to say it has to be considered seriously starting today.
Joining me now, the mayor of San Francisco, London Breed. Mayor, we were just speaking to Mayor de Blasio here in New York, who is considering basically shutting down our city. You've done that there. How's it going?
Well, so far, it looks like people are complying. They understand the severity of the situation, and it goes all the way back to when we first announced a state of emergency before anyone was diagnosed with the coronavirus here in San Francisco back in February 25th. We made it clear that it wasn't a matter of whether or not there would be a case. There would be a case, and the need to start focusing on this and making the hard decisions now was imperative to protecting people's lives.
San Francisco, like many other cities, has a homelessness problem. How do you take care of those people? How do you send them to shelter in place where they have no shelter?
Well, just so you know, again, by declaring a state of emergency, we immediately went into action, developing relationships with various hotels. So, for example, if someone is diagnosed with the coronavirus who not only is homeless but lives in a congregate setting where they're sharing bathrooms and they can't self-quarantine, we have the ability to do that. We've also rented a number of RVs. We knew that this was going to be a real possibility, and we needed to prepare for it, not just for people who are homeless and living in those congregate settings like our single-room occupancy hotels, but people who live with maybe a large number of people. So we have to be prepared for any situation, and we have to move quickly because we want to make sure that we have the capacity to handle what could turn out to be a situation where we have significant numbers of people who are diagnosed. The fact is now we have 43 cases. We do expect that to rise, and we are doing everything we can within our hospitals, within our hotels, and other resources at our disposal to prepare to address the issue as it comes.
You have announced an eviction moratorium for small businesses. How does that work?
Well, what we're doing, and the sheriff has been very cooperative here in the city, we're saying that no one can be evicted, whether it's a small business or a resident. We don't want evictions to take place because people can't, for example, pay their rent now because they were laid off their jobs or they're just not making enough income in order to support themselves. We're saying let's put a pause on that because we all are suffering throughout San Francisco, and there's going to be a need for us to address what we know is not just a public health crisis, but the economy and what's happening not just in San Francisco, but all over the world. You look at the stock market, you look at the fact that people aren't spending at restaurants, businesses, and other things, and people are already laying people off. We are going to be really in a very unfortunate situation as this situation progresses.
Mayor Breed, thank you so much for joining me. I appreciate it this morning. Be safe.
Thank you.
I want to talk about a different kind of American, those who are living in rural America, because there's huge concern that this virus is continuing to spread, the tax it's putting on some of our biggest hospitals in our largest cities, and they could run out of beds, ventilators, maybe even doctors. But another concern, rural America, where we know the health system was already strained before the coronavirus hit. Joining us now to discuss, Dr. Jeannie Marazzo. She's the Director of Infectious Diseases at the University of Alabama at Birmingham, and Alan Morgan, CEO of the National Rural Health Association. Dr. Marazzo, take us to Alabama. How well equipped are hospitals there? We're talking about New York City. We've got a lot more resources here.
Yeah, a lot of more resources and a lot more medical institutions. So when you look at a state like Alabama, which certainly has great medical care at certain institutions, you're also seeing a situation where rural hospitals have shut down because they have not been seen to be profitable. There have been other challenges. So you put that together with a population that has a higher percentage of comorbidities like diabetes, hypertension, cardiovascular disease, obesity, all the things that we know increase the mortality rate with this virus. And you have an incredible tinderbox of disaster. And that's really got us staying awake at night.
Alan, what are your biggest concerns as it relates to rural America and corona?
Well, right now, it's just maintaining access out there. As mentioned before, nearly half of the nation's rural hospitals are currently operating at a loss. We've had 6 rural hospitals close already this year. And now, across the United States, our rural hospitals are postponing elective services. We're trying to prepare for incoming patients at a time where we have significant cash flow issues. So the real question is, are we able to maintain this safety net 3 months out? Can we protect the access to health care that we currently have in rural America?
Cash flow issues mean staffing issues. Doctor, tell us what it's like for those healthcare workers in these hospitals, given how resource constrained they are.
So I would say there are a couple of huge concerns to emphasize, especially if we think about ramping up to use some of the rural facilities as essentially overflow systems to help us unload some of the challenges that we anticipate seeing at some of our central places. First of all, the need for personal protective equipment, i.e. equipment to keep healthcare workers from getting infected, is really urgent right now. We're burning through these supplies at a really frightening rate. So we need to figure out ways to keep people protected that does not continue to deplete the system, because we need those people on the front lines, and we can't afford to have 10% of them or 20%, as in Italy, taken out because they're sick. The other issue is that with patients coming in and worsening in terms of their oxygen requirements, we're seeing patients that are requiring transfer to ventilators, just like you heard from Bill de Blasio and other people. So the need for the infrastructure to oxygenate people, to take care of people, the intensive nursing support and respiratory therapy support that you need to keep people in those settings alive and have a chance of recovering is really staggering. And we're planning contingency plans to keep this up and running, but that is really scaring people right now.
Dr. Marazzo, thank you so much for joining me. Alan, thank you. And for you at home, thank you for staying with me this hour. As always, let's take a deep breath. We're going to get through this. Thanks for watching this hour. I'm Stephanie Ruhle. My colleague Ayman Mohideen will pick up our special coverage of the coronavirus crisis next.